Hello, my name is Allie Hildenbrand, and for my graduate capstone, I conducted a mixed methods analysis examining barriers in the Native Hawaiian healthcare system. Before discussing the current health system, a brief background of Native Hawaiian health. Evidence suggests that pre-Western contact, the ancient Hawaiians were very healthy and they lived very spiritual lives. The Pono Triangle symbolizes this. One is healthy when a person's spiritual, mental, and physical parts are all in harmony. Aina, the Hawaiian word for land, means that which feeds. Connection to Aina is essential to the well-being of Native Hawaiians. Within the first 100 years of Captain Cook's arrival to the islands, the Native Hawaiian population decreased by 90% due to Western communicable diseases. As non-native contact increased, Native Hawaiians began to lose possession of their land, and colonial forces banned the transmittal of native language, culture, and practices. The stars here point out the drastic decline in population. I like to focus on the I'ulamau study in 1988. Local leaders joined forces and alerted Congress of the poor health conditions affecting Native Hawaiians. The result of their efforts was legislation, the Native Hawaiian Healthcare Improvement Act, which established Papa'ololokahi as the Native Hawaiian healthcare system. Today, Papa'ololokahi has clinics located throughout the island chain, and they work to educate and assist Native Hawaiian communities by providing disease prevention, health education, and primary care services. Currently, Native Hawaiians have the shortest life expectancy and the highest mortality rates in the state due to cardiovascular disease, cancer, and diabetes. In 2021, Papa'ololokahi received $20 million, part of the American Rescue Plan Act. The grant included the 5 larger Papa'ololokahi clinics and then an additional 15 Native Hawaiian community-focused nonprofits that are smaller grassroots organizations. I'd like to talk about the significance of the name Namakawai. The Hawaiian taro fields, or kalolo'i, are traditional Hawaiian irrigation systems, and the makawai is the word for the inflow-outflow channel of water that nurtures the lo'i patch. In the same way, Papa'ololokahi nurtures the organizations selected for this grant and the Native Hawaiian communities that they serve. Dr. Giroux conducted the Namakawai program evaluation, and I was a research assistant on that project. We interviewed 18 organizations on Zoom. We used a semi-structured interview design, and the interviews all took about an hour, and then we transcribed them verbatim. Following a grounded theory approach, the evaluation team created a codebook via open coding that served as a reference and a structure to organize the data. Once the codes were defined, each transcript was coded by the program team, coding to 100% consensus. The data subset my project used were all codes labeled barriers. The program evaluation did not focus on barriers. Rather, these conversations came up organically. Also, one question from a supplemental quantitative survey was used. This slide here was created in vivo from all of the barrier codes, and I think it's a great visual. It really depicts the heart of most of these conversations, the importance of the health and community to these organizations. Barriers emerged in every interview. Within that subset of barrier data, 4 themes emerged: mistrust, access to care, funding, and free labor. Mistrust came up 24 separate times in 8 different interviews. Mistrust often refers to mistrust between communities and academia or outside researchers or service providers. The second barrier was access to care. I'd like to emphasize how remote many of these areas are, especially on Oahu's neighboring islands. Rural areas constitute 94% of Hawaii's total land area. Organizations said many rural areas have no qualified providers, and provider turnover is high in many of these areas, which hinders the continuity of care and damages trust within the community. Theme 3 is funding sustainability. The organizations noted that grants were challenging to apply for, and even when a grant was awarded, there was no guarantee it would be renewed, even if it was successful. Winning grants requires good data, which can be expensive and time-consuming to collect. Also cited a mismatch sometimes between funding agendas and community needs. The final theme was free labor. Free labor was discussed in 6 interviews and came up 11 times. Free labor refers to organizations that depend on their volunteers, practicum students, and overburdened staff to work uncompensated in order to keep the program running. This also refers to cultural experts working for free. A follow-up survey was sent out a few weeks post-interviews. 10 organizations responded to the survey. The research team provided a list of 40 possible barriers. Provider burnout was cited unanimously. In addition to the previously mentioned barriers, here we see food and housing insecurity in the community. I think that this information opens a door for some great discussions on how to better support these organizations, specifically policy advocacy and change, considering amending the Native Hawaiian Healthcare Act to reflect current needs. Next, creating grants designed to support the internal infrastructure of these organizations. These areas are often neglected, but are really important to the sustainability, longevity, and effectiveness of the organization. My study was limited. Notably, only 3 of the 5 health clinics had time in their schedules to conduct the qualitative interviews. I hope that this presentation enhanced your knowledge of culturally focused, community-based health organizations in the state and the barriers that these organizations encounter. Thank you for coming. I look forward to discussing this in depth with you in my symposium session. Thank you.